Good afternoon. Uh, Hope you are well. Today we are looking at mental health, and the topic of discussion we want to look at schizophrenia. So the main focus for today, we are just going to look at the definition. We'll look at the causes or the risk factors. We are going to look at the signs and symptoms, the levels of schizophrenia, and the types of schizophrenia. Then, for management, we are going to have it done on a separate session. So this condition is one of the most important conditions in mental health. And what you have to understand is that mental disorders are mainly classified into two classifications. We've got what we call psychotic, and what we call neurotic. So, schizophrenia is a psychotic condition or mental disorder. By psychotic, I mean the individual who has got a psychotic disorder has got loss of touch with reality. It's where they fail to interpret the environment correctly, or in short, the individual is disoriented to time and place. We call that loss of touch with reality. That's why you find this condition falling. So, by definition, schizophrenia is just a psychotic condition. Sometimes it's called a syndrome because there are so many things that are involved in one condition. So it's called, it's defined as a psychotic disorder in which there is what? There's profound disruption, or we can say disruption of what? Perception, that is one, perception. Then number two, there's also disruption in what? Cognition, that is it, mental process, cognition. Then there's also a disruption or disturbance, profound disturbance in what? Behavior. So that is the schizophrenia. So it is a psychotic disorder in which there is profound disruption in perception, cognition, and behavior. That is how we can define schizophrenia in simplest form. So here I'm just giving you simplified versions of the condition so that we're able to understand quickly and grasp the information. What causes this condition is that one, or what brings about schizophrenia, the risk factors. We can look at number one, there is family history. So family history. So it means that if an individual is born from parents with such a condition, them too, they are put at risk of as well having the condition. So family history, which can also be written as genetics, and then sometimes it can be as a result of substance abuse or drug abuse. Substance abuse, at times it can be as a result of some medical conditions which affect the brain. For example, we can talk about meningitis, encephalitis, conditions which can just affect the brain and they cause inflammation in the brain. Somebody can begin to present with the psychotic signs and symptoms. So there are so many causes or risk factors that an individual which can put one at risk to develop such a condition. Then there's also structural deformities of the brain. All those things can bring about this condition from occurring. So it happens like that. So those are some of the risk factors of schizophrenia. You can also add on signs like psychological factors, social factors. All those can put one at risk to have this condition develop. So now, what are the signs and symptoms of schizophrenia? When dealing with the signs and symptoms of this condition, you have to understand that the signs and symptoms are classified under what we call either positive or negative signs of schizophrenia. When we say positive or negative signs of schizophrenia, what do we mean? You find such questions being asked in the exam. So where we say positive signs of schizophrenia, it means that there is any abnormal addition of something that is unusual to the patient's experience. Abnormal addition of, we can say addition of abnormal experience to someone's behavior and all that. Where you find signs such as what? Hallucinations. You find hallucinations here. Hallucinations is where an individual begins to have perception without what? Stimuli. Then the patient can have other signs like illusions. So illusions is where the patient is doing what? Misinterpreting stimuli. Then you also find signs such as delusions. Delusions are just false beliefs and all that. So there are so many signs you can find under positive signs of schizophrenia. But for now, we can have 3 of them. Then in negative schizophrenia, so when we say state or list the negative signs of schizophrenia, negative signs means that what? There is a reduction. There is a reduction in what? Normal functioning of an individual. There is a reduction in the normal functioning of an individual. We call them negative signs. Then in simplest form, if you don't want to forget, the simplest version, how you can just differentiate the two, positive and negative signs. Positive signs, these are the signs such that when they are present in the condition, in here, they can help you to diagnose schizophrenia, or they point to the condition. So we call them positive signs. Then the signs which are vague, you might not use them to diagnose the condition. We call them negative signs. I hope that's clear now. So in negative signs, you will find signs such as what? Social withdrawal is going to be social withdrawal. Patient will present with such signs. There's also decreased motivation. Then there's as well what we call anhedonia. Anhedonia is loss of interest in activities previously enjoyed. So if the patient used to play soccer, this time they will not be able to participate in that activity. So we call that anhedonia. So these are some of the signs of schizophrenia. So they can ask you to say, what are the, or state the positive signs and the negative signs of schizophrenia. So you write that way, meaning you've written the positive and the negative signs of schizophrenia. So the other point that you have to look at is what? How the condition progresses. How does schizophrenia progress, or how does one move from one phase to another phase? So look at the levels of schizophrenia, or we can say phases of schizophrenia. How does the condition develop? How does it progress from one stage to another? So stage number one, or level number one, we call it what? Prodromal phase. Prodromal phase. What is prodromal phase? This phase is what? The initial phase of the condition, or we can say it is the first phase that happens in schizophrenia. Here, in the prodromal phase, you find negative signs present here. Remember the negative signs we had talked about? You find them present in the prodromal phase or level. You find the negative signs present here. This level, the prodromal phase, sometimes it's mistaken with what? Depression. People will think the individual is just is being depressed and all that because of the signs that are present here. Anhedonia, decreased motivation, apathy. You find such signs present here on what? Prodromal. That is the first phase or level of schizophrenia. Then we go to another phase or level of schizophrenia. After one has gone through the first level, if the condition goes untreated or improperly managed, the individual will have or will graduate into the other phase, which we call active phase. So it's called active phase. Active phase. So the active phase of schizophrenia, this one is where you find psychotic signs present on this phase. So on active phase, you find psychotic signs present, or we can say prominent. They are visible at this phase. So they're prominent here. Psychotic signs, these are signs which are explained that the patient will have or will present with the loss of touch with the reality. What are those signs which shows that there is a loss of touch with the reality? I mentioned to say there is what? Hallucination, illusions. So those ones you find them on what? Acute phase of schizophrenia. So that is the second phase. So that is 2. That is it. Phase number 2, active phase. So you find the prominent signs of schizophrenia like hallucinations, illusions, and delusions. They are present at this level of active phase. Then number 3. Number 3, we'll look at the residue phase. We'll look at the residue phase. That is number 3. So put 3 here. Residual phase. So on residual phase, here you find the psychotic signs, or we can say this is the level where the signs and symptoms of this condition are less severe. Only this sign, they are what? Less severe. You won't find signs such as hallucinations and illusions at this level. Those signs, they do what? They decrease at this level. I want to call the residue because there is a reduction of those signs and symptoms which are profound in this condition. So residue simply means the psychotic signs have now decreased, but you also find the individual showing those signs of discrepancy in terms of concentration and all that. So here, that is the residual phase of schizophrenia. So number one, there's what? Prodromal phase. Number two, there's active phase. Number three, there's what? Residual phase. The other part you have to know is what? The types of schizophrenia. What are the types of schizophrenia? If you don't want to forget the types, just use the acronym PARADISCA. Depends with how you pronounce it, but it's what? PARADISCA. So the para, this one, para. So type number one. Type number one on schizophrenia is what? So we're looking at types now. One is what? Paranoid. Paranoid. Schizophrenia. This type is where you find the patient presenting with what? What we call persecutory thinking. Persecutory thinking or thoughts here. Persecutory thinking. The individual shows behaviors of what? Suspicion. The behaviors that are present on paranoid, it's a kind of behavior where a patient behaves as if people are planning evil against him or her, people are following him behind, and all that. So, thoughts that are found here are what? Persecutory thinking. So, paranoid simply means the individual is having a persecutory thinking. Thinking that people are planning something evil about him or her, they want to maybe to beat him, something like that. So we call that paranoid schizophrenia. Here you will find positive signs of schizophrenia present here. Positive signs are present. So when you're explaining, you should state or you should write those positive signs that I'm mentioning here. The hallucinations, delusions, they are found on paranoid schizophrenia. Then the other type of schizophrenia is what? Simple schizophrenia. That's number two. Simple schizophrenia. So this one is a rare form. It's rare. You won't find it so much common in individuals. It's rare. There's also what? In simple. This type you find, you won't find positive signs and symptoms here. Positive signs and symptoms are not present. In simple schizophrenia, you won't find positive signs here. Positive signs are what? Are not present. Are not present here on simple schizophrenia. Then we go to what? Disorganized schizophrenia. It's also called the hebephrenic schizophrenia. So disorganized, that's number three. disorganized schizophrenia. This type of schizophrenia is where you find the patient presenting with the disorganized behavior. Disorganized behavior. The patient also presents with what? Childlike symptoms or manifestation. The patient behaves with it or shows signs of childlike behaviors, inhibiphrenic childlike behaviors. Number 3, you find the individual in this type of schizophrenia having what? Difficulties with maintaining daily activities. So there's disturbance. Disturbance in what? Performing or performance of normal daily activities. That is in what? In a disorganized schizophrenia. Then the other one is what? It's called catatonia or catatonic schizophrenia. That's number 4. It's called catatonic schizophrenia. This one is where you find there is what? Psychomotor disturbance. There is a psychomotor disturbance. Motor means movement. So here you find the patient presenting with the signs and symptoms of disturbed movement and the posture. You find the patient showing signs of stupor and what we call waxy flexibility, where a patient will stand in one position for a long time. The patient will just stand in one position for a long time. We call that waxy flexibility. So in here, there is what? Disturbance in terms of movement and the body posture. You find signs such as waxy flexibility, where a patient will stand in one place for a long period of time. We call that catatonia. So this one simply means there is disturbance in psychomotor movement. That is in simplest form. Then we go to what? Number 5, we go to what? Undifferentiated. Undifferentiated schizophrenia. Okay. So let's write it properly. So undifferentiated schizophrenia. So this type, if the patient is showing a mixed form of symptoms, mixed form of symptoms from all or more than 2 of the types of schizophrenia, then we call it undifferentiated schizophrenia. It's where a patient is having a mixed up of signs and symptoms from paranoid, from hebephrenic, from catatonia. They are all occurring at the same time or in one person. So we call that undifferentiated schizophrenia. It's where there's a mixed up of signs and symptoms from both types or all the types. So we call it undifferentiated. So it means you find hallucinations here, you find wax flexibility, you find illusions present in this side. Disturbance in maintaining daily activities, they are all here. Why? Because there is a mixed up of signs and symptoms from all the types of schizophrenia. Hope it's clear there. The final one, we call it what? Residual schizophrenia. So residual schizophrenia is used, or it means that an individual had history of schizophrenia. He or she had history of schizophrenia, but the signs and symptoms have persisted here. So there's history of the condition, schizophrenia. The signs and symptoms are what? Persisting. Persisting. Even if they are persisting, they are not profound signs and symptoms. So in short, you find negative signs and symptoms in residual schizophrenia. So you find negative signs here. Negative signs. Negative signs like apathy, decreased motivation, anhedonia. You find those are signs present in residual schizophrenia. So it means there was history of the condition, and then but the signs have done what? They are persisting over and over again. Even if they are persisting, they are not positive signs that are persisting, but they are what? Negative signs that are persisting in this individual. So we'll call it what? Residual schizophrenia. So that is where we will end for today on schizophrenia. So we've done the definition, we've done the causes, signs and symptoms, and the types of schizophrenia. So takeaway points: this condition is a what? Psychotic disorder. Pick it from there and understand that how you manage this condition is different from other conditions which may be neurotic or mild in form. So for today, we'll end here. We are going to meet again in the other session of management. We go through together and understand how things are done. Thank you for watching. So we'll end here for today.